Should COPD patients use CPAP? Imagine sleeping peacefully through the night without waking up tired or gasping for air. For some people with chronic obstructive pulmonary disease, or COPD, that dream can become a reality with the right treatment. But is using a continuous positive airway pressure machine, or CPAP, always the answer? Let's find out. CPAP is a device that gently blows pressurized air into your airways through a mask. It keeps your airways open while you sleep, mainly used for treating obstructive sleep apnea. Now, many COPD patients also have sleep apnea, a condition called overlap syndrome. For these folks, CPAP can be a game changer. It helps improve how well they breathe during sleep, leading to better oxygen levels and less fatigue. Research shows that COPD patients with overlap syndrome who use CPAP regularly tend to have fewer flare-ups or exacerbations. These are episodes when symptoms suddenly worsen and may requiring hospitalization or medication changes. Using CPAP consistently can also lower the risk of death in these patients. Even just a few hours of nightly use can provide benefits, and longer use tends to improve outcomes even more. From a breathing standpoint, CPAP can make breathing easier by reducing the effort needed to breathe. It helps decrease the work of respiratory muscles and improves overall lung function in stable COPD patients. However, it's important to note that CPAP can sometimes cause increased air trapping in the lungs, which is called dynamic pulmonary hyperinflation. This means careful monitoring by healthcare providers is essential. In clinical practice, doctors often recommend CPAP for COPD patients who also have sleep apnea because it directly tackles airway blockages during sleep. For those with COPD but no sleep apnea, CPAP's benefits are less clear. The decision to use it should be made after a thorough evaluation by a specialist, considering the patient's overall health, sleep patterns, and comfort with the device. In summary, if someone with COPD also has obstructive sleep apnea, using CPAP is generally advised. It can improve breathing, reduce flare-ups, and even lower the risk of death. For COPD patients without sleep apnea, the use of CPAP depends on individual circumstances and should always involve medical advice. This approach ensures the best possible management of their condition and quality of life.